Good afternoon. I hope everyone had a good lunch break. Hope everyone is awake. Hope you didn't get too full and you guys start snoozing on us. Oh, there's Danielle. I was just looking to see, make sure you got in here.
Good afternoon.
Hello. You do have permission to share your screen, so if you want to go ahead and check that out. Perfect. All right, we will start back this afternoon with Danielle Nelson with the US DOT Federal Transit Administration Office of Rural Targeted Programs. And she will talk with us about the CCAM.
You can see my screen okay, right?
Yes.
Okay, great. All right, thank you all for having me. I just wanted to give you guys a quick update. Let me just make sure I can advance my slides, okay? Okay, we're good. So I'm sure everyone here knows about the Coordinated Council on Access Mobility, or CCAM, originally an executive order back in 2004, and then it was put into the FAST Act in 2016. And so now in our statute, we're required to have a strategic plan. The focus is still the same. So it's about improving access and efficiency of human services transportation for the three populations you see on the screen there. So older adults, people with disabilities, individuals of low income, and it's still the same membership. So it's chaired by the US DOT with partners from the other 10 departments. But the thing that we've done differently this go round is, instead of partnering at the departmental level, just like DOT has done to delegate it to FTA, we are working at the sub-agency level going forward. So there are 28 sub-agencies across those organizations, those federal departments you see, and that's who we are working with currently. And so I will take you through here and just share with you the strategic plan. I'm just going to share with you the mission, which is the CCAM collaborates to improve transportation access for all. And our strategic plan that we kicked off implementation in February on, we have 3 specific goals that you see there, and we have 27 performance measures that are actionable items we are tracking. 11 of those performance measures we're implementing this calendar year, and the strategic plan is following calendar years, not fiscal years. And so the goals are to strengthen the CCAM and to improve multi-sector collaboration at all levels and jurisdictions. Goal 2 is to promote the development of safer and more accessible transportation networks. And with that goal, we are working closely with federal highways and also our other mode sister agency, NHTSA, National Highway Traffic Safety Administration, as well as CDC. And then goal 3 is to address CCAM policies that impede transportation coordination. And this one has a significant implication for non-emergency medical transportation as well. So we, in 2019, undertook the CCAM program inventory, and it was published in 2020, and it includes 130 different federal programs that can fund human services transportation for one or more of those 3 populations. And we are currently, as part of the strategic plan, updating this inventory and combining it with the federal fund rating guide, because we heard in listening sessions from you all that these are great resources, and thank you, but it would be more helpful if they were in one searchable database. So that is what we and the other 28 sub-agencies are working on. And I should mention that 9 of the 11 federal departments fund programs. The only 2 that do not is the National Council on Disability. They don't have any actual programs, that's why, and the Social Security Administration. But all of the others have programs. And I thought it would be helpful for this group. In the program inventory, we asked in 2019 4 specific questions about the eligibility of those programs. And one was, is mobility management eligible? And so in the inventory, there are 74 programs where mobility management is an eligible expense. And we used our definition in federal transit law of what mobility management is. So I thought I would just highlight that. And in the federal fund rating guide, we also looked across statutes. And so, as you guys all know, that we have 3 FTA programs that has explicit statutory authority to accept other non-DOT funds as local match. And so those are the 3 formula programs I linked here. And I also quoted the federal law where it's included. And I also linked to the 2005 House of Representatives report, where Congress talks about why they added that that explicit authority in our legislation. And the Federal Fund Rating Guide, what that is, it explicitly explains what federal fund rating is, which is when you take federal funds from one grant program and you use those to fulfill the local match requirement of another. And then we specifically discuss when it's eligible. And there are three opportunities. Either the statute for a federal program is silent, which is the majority of the health and human services programs we looked across. I should mention, we haven't completed all 130 programs. In 2020, when we published this guide, we only got through 61. And the reason why it was a very heavy lift, we met with our general counsel's office and the general counsel's office of the other federal department, and then also the program manager of the other federal department. And we had to look at their statute and confirm, is it either silent? Does it have explicit statutory authority like our three programs do? Or is there an explicit statutory prohibition, which Department of Justice had prohibition in all of their statutes and programs that are included. And so we completed that inventory for 61 programs, and we are now working to do the full 130 that will be included in the update. And I know you guys heard from Steve earlier today, so I'm probably late to share this. In one example of a mobility management federal fund rating example is what New Hampshire is doing, where they're using CDC funding as the local match to their 5310 project. And I've cited there the source, which is you can hear directly from New Hampshire on their project, and it's a podcast that was done there. And then I thought it would be of interest. I served as the FTA liaison to a TCRP panel, and I just copied and pasted some information from the report that was recently published, and it's about partnerships for equitable pandemic response and recovery. And so what they did in this is they did the literature review, and then they did a survey of transit agencies, and then they did 4 specific case studies. And I thought, since one of the case studies is from Florida, I just wanted to share this with you guys in case you didn't have time to read the full report. And so 113 transit agencies completed this survey. In Region 4, you guys were the second highest response rate. The majority of the transit responses came from rural communities. And the survey responses, one of the questions was, what type of cross-sectoral partnerships did you undertake during COVID? And I thought it was interesting that food banks were very high up there, as well as hospitals, nonprofits, public schools, etc. I just saw there's something in the chat, but it's not a question. And if you guys do have a question, please feel free to interrupt me and ask now, because I do want this to be informal. The funding sources, another thing I thought would be of interest to this group is 11 transit agencies reported using non-DOT federal funds for their COVID non-traditional transit initiatives. And then some of the large takeaways from this research was lessons learned and success strategies that the transit agencies reported. The ones that had strong pre-existing relationships with other partner organizations within their communities were best able to pivot and respond. And they also reported that clear communication with partners as well as the public was really helpful. And they thought that the implementation of these incidental use and non-traditional transit programs led to greater recognition of public transportation's role in their communities. And then one example of the 4 that's included in the report is from Bay County, Florida, and the Bay County public transit system. They reported that having a lot of partnerships developed because of their experience responding to Hurricane Michael back in 2018 really allowed them to pivot and response when COVID hit. And some of the community partners for the initiatives they started was the Bay County Public Health, their Emergency Operations Center, the state HHS, as well as the Bay County Council on Aging and the local schools. And what they did was they provided COVID testing, mobile testing and vaccination clinics. They provided food access where they shuttled food to distribution sites, as well as delivered food to homebound residents. And they also partnered with their local VAMC, their VA medical center locally, and they provided 500 veterans experience experiencing homelessness with access to vaccines and testing. And then one last example I thought might be of interest to this group, especially because I know NCMM has a real food focus as well. In Lake County, Ohio, they used a lot of data from their 211 non-emergency helpline, as well as data from the Greater Cleveland Food Bank, and then Census Bureau poverty data. And they looked at where they really need to focus their food access initiatives during COVID. And long story short, it's led to a permanent establishment of a mobile food bank that involves multiple partnerships and funding arrangements. And they reported that the number one success factor they had was partnering with other community partners before the pandemic helped them to lead to this food access program that they started. And then one other thing I wanted to share with you all is FTA, we issued transportation coordination guidance in 2022, but there was this minor thing happening at the time, something called COVID. So it really got lost in the shuffle. And one of the other misconceptions that we've heard is that this guidance, when it came out, was assumed to be COVID specific. But we are right now pushing it back out to help clarify that this transportation coordination guidance has nothing to do with COVID. It's not mentioned. COVID is not mentioned anywhere within it. It actually was started before COVID hit, but we paused it. And it really came about because there was some miscommunication with a couple of grantees in their National Transit Database reporting when they were doing incidental use and demand response partnerships with human services agencies. So that's why we developed this guidance. It was developed by our TBP, the Budget and Policy Office, and our General Counsel's Office, as well as our Office of Program Management and Region 5, because that was where the confusion originated. And so what this guidance is clarification about when multiple entities are working together to deliver a transportation service. And really the goal is to reduce the overlap between different programs providing transportation to siloed, so older adults versus people with disabilities versus veterans. So if you coordinate how to report to NTD properly. And so this guidance specifically talks about charter and the charter exemptions and incidental use and trip brokering. And I've linked to, on this last slide at the bottom, to the Gov delivery notice that we published in 2022, as well as the transportation coordination webpage where this guidance lives, and then the actual document. And all of this went through FTA's Policy Council before it was released. And so the incidental use guidance, it also includes information about examples such as vehicle sharing and meal delivery examples. And as you all know, incidental use is permitted for all recipients of FTA programs. And really the stipulation is that the incidental use can't impede public transportation. So as long as you have the capacity, and I know with COVID ending, the capacity is probably changing a bit and it's less likely you have the opportunity, but incidental use is eligible. And we also have a section on the charter service exemption. So of course, there's the qualified human service organization option to register on the website. But one of the best kept secrets is that there is the Appendix A, which is the list of CCAM agencies that fund human services transportation. And what's exciting is FTA is updating that. And it's been a long time coming because Appendix A was published back in 2008, January of 2008, and it only includes 64 programs. And as I mentioned just earlier, we now know there's 130 programs. So that number has grown significantly. And the update will update that Appendix A list to include all of the programs. And so if you partner with any organization on Appendix A, they do not need to register on the FTA's website, charter website. If they receive funding, they are automatically exempt from the charter rule and the partnership can continue. And so the photos I have there is an example of Older Americans Act funding for supportive services for senior centers, and the one below it is Head Start example. And then there is on the guidance website, clarification about shared ride, because this one was found to be confusing. And so it gives an example of a qualified human service organization who partners with local transit. Not all of the trips have to be shared ride, just an attempt to make them shared ride is required. And then it gives the example of a qualified human service organization that serves people with severe disabilities who cannot ride with anyone else, in which case you would not report those trips to NTD, but those trips are allowable as the Qualified Human Service Exception, Appendix A, if they receive any funding, like Medicaid, for example, or as an incidental use trip, but it wouldn't be reported to NTD because it wasn't shared ride. And then the clarification in the guidance links to the NTD reporting manual. Another best kept secret that we found and why we put this in the guidance is that human services trips are reportable to NTD when they are sponsored service. And sponsored service, there's a section in the NTD reporting manual on page 132 that explains that sponsored service is paid in part or in whole by a third party. So Head Start, Meals on Wheels, Medicaid, etc., Centers for Independent Living. In which case, if it's part of a coordinated human services transportation plan, it's eligible to be reported to NTD. And so that information is in both the NTD manual, and then we link to it in that guidance clarification. And I just wanted to leave you all with our technical assistance. Of course, you're connected in with National Center for Mobility Management. But of course, there's also multiple other technical assistance centers. If you ever need assistance, there's the contact information there. And we're very proud of the Transportation Technical Assistance Coordination Library that links resources. So it's just a one-stop shop for if you're looking for a case study or examples of bike share, or you can go to Tackle's website there and type in what you're looking for. And then it searches across all of our different TA centers websites as well as FTA, and then brings up those resources. And when you click the link to them, it'll then take you to the homepage of where that resource lives. So it's just a coordination site. And with that, I've linked to the CCAM Gov Delivery notice. We're starting to really use that Gov Delivery. So if you don't already subscribe, I would just recommend clicking that and subscribing to the CCAM listserv. And whenever we have information, we send it out to that listserv. And with that, I'll ask if anyone has any questions.
There is one question in the chat related to the CFRPC, one of the participants, asking about that they receive FTA grants and administer them to a for-profit CTC. CTCs in Florida are the Community Transportation Coordinators. And it's presenting a challenge because federal rating for rural counties that the CTC provides transportation, they have been told that rating to help create match does not qualify since the CT is for profit. So I guess they want to figure out roadmaps, if there are roadmaps for navigating around that requirement.
See, so FTA grants and Mr. So I'm struggling.
And maybe what we can do is, Heidi, one of our steps afterwards is to do direct technical assistance. So perhaps this one is perhaps not easily answered, but we can reach out and coordinate a meeting with the parties that are interested and engaged, and we could figure out the roadmap for doing this.
So I'm just curious, if it's an FTA grantee, right? So the CTC receives FTA grants.
The CTC is a state agency, so I think that's where it gets a little bit confusing for us, because we have a separate state agency that administers transportation services for people under the Transportation Disadvantage umbrella. So what we could do is come up with a meeting, because it is definitely something that we want to do, because the CTD, which is the Commission for Transportation Disadvantaged, there's a large statewide organization, and CTCs, the Community Transportation Coordinators, are the ones that are supposed to be coordinating the trips in their region. So it's not a federal program; it's a state program, and I think it's that blending. So Heidi, as you said, yes, please, and then we'll work to follow up don't let us not forget, but I know Jonathan and I are taking copious notes with Anjali so that we can get follow-up on that one.
So is that, just out of curiosity, is the federal funding, you're just curious about which programs go to other state agencies in the program inventory that then could be used for federal match? So matching at the right level?
I think the CTD funds have been used in rural areas for match for 5311 grants.
Mm-hmm.
But again, I'm going to start speaking in an arena that I'm not an expert in fully. So I don't want to misstate things. But yes, that's kind of the issue that we want to kind of uncover. And again, this is why we're having this conversation, because we do want, I know Heidi and CFRPC, they're a regional transportation agency, and they have a large area that they serve. And they want to find out a way that they can, leverage all of the funds as well as leverage mobility management techniques. So Heidi, we'll reach out to you. Okay.
It looks like, so Danielle, I guess a better example. So the RPC receives funds, and then they receive funds from the RPC is what I should say. So they receive a grant from them that disperses it. And then, but they're looking to get additional funds because we know that probably the small amount they get cannot fully run the system. And so they're trying to figure out a grade. So the confusion is it okay to maybe use funds from DHSS or funds from USDA or things like that? And then the higher question is, well, do we want to give them funds because they're getting funds from somewhere else? And the explanation is that really you should be partnering and things like that. And it may come from somewhere else. It may be from aging, because a lot of times we're transporting the same population to the same places. But that maybe breaks it down a little bit more. And I think there's worried about auditing issues and things like that, which I'm not sure why, because if those funds came from like USDA, it would have anything to do with the other, but.
So one of the new programs we're adding to the inventory is CNCS, the Corporation for National Community Service. You've probably heard of like AmeriCorps, and they also fund the RSVP program, the Retired Volunteer Service Program, and they have funding that can be spent on transportation for those, so like volunteer driver programs. And so we just clarified with them, not only are we adding their program in there, it also can be used as match to 5310. So we are adding a couple new programs. That would be one example. And then in the drop down of the program inventory, it says who receives the funds. Actually, let me see if I can share my screen so we can actually share the program inventory directly. And we can look at it. I wish I was more tech savvy, just bear with me. All right, let me share my screen again. Is my screen back up? Oh, wait, no.
Yes.
Let's see.
Yes. Well, it was.
It was. Okay.
Yeah, just one. There it goes.
Is it showing the CCAM homepage?
Yes.
Okay.
Yes.
So if you go to the CCAM homepage at the related documents, here's the CCAM program inventory. And then so if you're curious to know, so maybe it sounds like you're looking at sort of a state situation. So let's go to the primary recipient. In this case, we're really looking for state. I guess we should do all that can go to states, which is a lot. And then so maybe you're specifically looking, is it older adult specific or no?
No, I don't. I think well, a lot of the times with the CTD funds, it is persons that are transportation disadvantaged, which includes seniors and those who are living with disabilities.
Yeah, it's both 5310, 5311 funds.
Okay, so the all. All right, and then is it only mobility management then? That you're, or are they looking also for trips?
I imagine it's probably a combination of all things.
You probably want us to be able to fund trips and mobility
And
management.
mobility management.
Okay.
Yep.
Right. So then basically this is, so, but not vehicle purchase, we're looking for transit. So this, all of these programs now that are left can either fund transit trips or mobility management. So that's what we're left with here. And it goes to states. So you've got like the adult drug court program from Department of Justice. And so here's where you could sort of start with and looking at these programs. And then unfortunately now you then have to go into the program, the federal fund rating guide to see if, so you've now confirmed these programs can fund what you're looking for, and it goes to the state within Florida.
This is great, Danielle, because this is the kind of tools that I know everyone's trying to do. And Heidi, you know, I think, well, actually, I know there's some uniqueness with our CTD because it's a state funded, you know, funded by state dollars. And CTD has its own form of kind of constraints and restrictions about how dollars can be sent. So their funds are restricted. So that might be also playing a barrier in this. But again, our goal of the summit, right, is to kind of introduce us to these opportunities and then give us an opportunity to do a direct outreach to each of the, you know, kind of leverage the National Center's technical assistance skills, and then be able to really target the solutions that we want to be able to provide. So this has been, what's great is that that's our point, right? We want to illuminate the opportunities that other federal funds, as well as how mobility management can help facilitate some of that braiding opportunity. So this is great. We really appreciate that.
Martin, is the CTD, they only have state funds, or is it federal funds passed through states?
It's only state funds.
Okay, I just wanted to make sure they don't receive any federal. Okay.
Yeah. So that's I mean, that's one of the, you know, it's kind of one of those things where there are blessings related to that program because it does work hard to coordinate those services. But I know it's a different different animal in a sense than what we experience in some of the other states. So Heidi, this is great. And actually, you've been great throughout the thing, being an active participant for us. We certainly want to be able to reach out and coordinate. I know Jonathan and I will, and Melissa, and we'll coordinate with you afterwards.
And since I'm on the webpage, I just wanted to show you, this is the transportation coordination webpage I mentioned that includes that guidance on the NTD reporting.
Oh, excellent.
That
was actually news to me. It was actually news to me. I know we this is slightly separate, but CUTR works with the state to help check on the NTD databases and inputs from all the transit agencies, and recognizing the benefit of this, because I know we've been working hard with Vanpools and how they also add to the total trips for a transit agency. It's good to know that this also can be leveraged.
Excellent.
Actually love it when I learn something new.
Yeah, great. We realized that it came out at a really bad time when everyone was extremely bombarded with all things COVID. That's why we're sort of bringing it back out and reminding everyone. And we'll be presenting at CTA on this as well next week.
Oh, great. Excellent.
Danielle, this is Jonathan, also from CUTR. In the previous session, we kind of heard a little bit about, you know, sometimes the braiding thing is overquoted and people might just want to say, hey, this HHS thing is there. We're good. Here's my match. But can you maybe weigh in on any pitfalls with that you've seen or best practices? And I'm kind of thinking about coordination here might be the underrated part, but it feels like something you can't just quote and then your match is magical. It sounds like the coordination really needs to be built, which is part of our, you know, next effort and technical assistance. But any thoughts you have or experiences with the realities of trying to match with some of these different, not silos, but you know, federal agencies and programs?
Yeah, I think that the biggest thing is that the Administration for Community Living is the only federal partner who has an FAQ publicly on their website that explicitly says you can use our funds as match to FTAs. So we're working to have others put it on their web pages, because I think that's the tough part, because FTA is saying you can do this. We've got this federal fund rating guide, but you have to really know where to look. And so Steve in New Hampshire is doing this great example. And so we had another grantee who's trying to do the exact same thing using $5311. But unfortunately, they asked the wrong person at CDC that said, oh, you can never do federal fund rating. This is unacceptable. So it's a constant need for education that we're doing with our partners, because if you ask the wrong person, everyone says federal fund rating can't be done. It's just that we have explicit authority in our statute, and it surprises most people. They don't think that exists. And so that's why it's just a constant need to share that. We've luckily educated the person at CDC and gotten the right answer, which is, yes, you can do this. So now this other grantee is going to be able to follow New Hampshire's lead and do the same thing with CDC dollars. So we're working on that now. The other challenges in the federal fund rating guide update, we just listed the program, but didn't differentiate between which ones are formula and which ones are competitive or discretionary. And there's a difference because with competitive, you've applied for a grant and said you were going to do something specific with it. And if, for example, in the case of this other grantee trying to follow New Hampshire's lead, we just need to make sure that that CDC competitive application said they were going to do transportation. It was eligible. We know it in the notice of funding opportunity. So you just have to make sure that whatever you're using as match, if it's a competitive match, that application included transportation. And luckily it did, so we're good. But it's just you have to check an extra box. And we're going to be clear about that in the next federal fund rating guide update and the difference between that match. So the long story short is you've highlighted an important topic, which is sometimes it seems like more work than it's worth, but it's because we're just starting to really get it out there and see people like New Hampshire doing it and leading the way. We're clearing the guidance to match so the federal bureaucracy gets out of the way. So I guess just bear with us. We're updating a resource to make it easier on everybody. And that's what we're working on right now, and educating all the federal program managers, since there's been a lot of changes just since 2020 and today. So a lot of new folks that didn't, again, know this was possible.
I really appreciate it. That
Great.
was a great response. Thank you.
Yeah, I just want to reiterate that that's, such a thing that we're always, like you iterated or explained, that there's an example of even a federal agency that sometimes is not aware, especially when these new programs, which are not straightforward, that can have some degree of complication and involvement. I think that's Jonathan's point, that he's always saying, look, some of these things are possible, but not easy, right? Mm-hmm. And navigating the system is important. Did you say it was New Hampshire that has led in a couple of examples? And, it's always nice when you see other people cut their teeth, right, on the experience. Mm-hmm. And I can tell that you all are working hard to say, oh, let's do this or tweak this or provide greater feedback. And again, what we want to do is leverage this interaction as the set point for our technical assistance, because we'll provide it as CUTR to the District 1 agencies. And of course, we'll lean on the National Center and their connections, their inputs, and their insights to help navigate the process, because the intention of the summit, right, is to move us towards leveraging all tools that are in our tool belt. I guess is the best way to describe it. And that opportunity, I think, is present with, especially with a lot of our follow-up. We knew this summit would kind of spark a lot of discussion, hopes and dreams and wishes, right? But then also it's going to be requiring us to do the work to get us in that position. We certainly hope our technical assistants will be able to support that activity, especially for some of the non-urbanized area agencies. So this is really extremely helpful.
And I think what's really key too is to use Congress's words. That's why we link to the House of Representatives report and quote Congress about this federal fund rating that they made eligible to us since 2005, is really because the federal investment increases coordination among federal agencies. So this is Congress's intent, the authorities in our statute for these 3 specific programs. And so it's just really, as long as we're very clear that this is congressionally allowed, and it's in statute. And that's what we're leading with whenever we have these conversations about federal fund rating with our federal partners.
Perfect. Thank you, Danielle. Appreciate it.
And any other questions? I probably should be looking at the chat.
That's okay. We're looking for you.
Okay.
Please feel free to ask questions.
Yeah.
This is the time to ask any questions that you have. If it's something else besides CCAM, any other programs that are out, or maybe we can direct you anywhere. Danielle can direct you somewhere else if she doesn't have the answer.
I don't have the answer. I know a lot of smart people that I can get it from.
Perfect. That's sometimes the most important role, right? Know where to go. But again, we appreciate, and again, Heidi, I know there's others that are thinking the same thing. At the end of our day today, Anjali will have a survey about about today's sessions, but also will be an opportunity for us to connect with you about questions and technical assistance. And I know there are a few folks that are already using mobility management staff and funds. And so we know we'll be connecting with you. We'll also be connecting with folks who aren't leveraging them yet and find roadmaps for providing, direct technical assistance and finding the applicability of these, these tools.
And do you guys all know about the Mobility Management Forum on Monday that National Center for Mobility Management is hosting, FTA funded? So it's happening in Oklahoma City, but it's being live streamed. Let me pull up the agenda.
And a value added session.
The slides are slightly different than the ones I presented here, but our regional administrator, Gail Lissy of Region 5, is presenting on ability to use flex funds, including for mobility management. So I thought that might be of interest to this group, and you can tune in virtually, which might be of interest. My boss's boss are both speaking. So you'd hear from multiple different FTA federal perspectives. Let's see, let me find them. There's a public website, and then I have I'll put in the chat where to register so you can.
Excellent. Excellent.
Let me share my screen, because if you watch me fumble to get there, maybe then you'll be able to find it too. So if you just go to NCMM's homepage, which if you just type nc4mm.org, it'll take you there. And then you go to mobility management, and it's the second one here. And then here's the forum. So this is the agenda. And if you, let's see, you should be able to register at the top. Okay, if you register here, that's the click. Oh, to register for the live stream. So you click that. And then here, I just wanted to share with you guys that we have Minnesota is coming to talk about how they're doing a Medicaid waiver, or how they're funding transportation, Medicaid funded transportation. And they presented ACTA, and it was it was a great session about how they're being innovative to get Medicaid funding. But also we have HHS coming. So he's the chief medical officer at HHS, and he's going to talk about community health workers and how their funding can be used as match from mobility management and how they're similar. So that's going to be a great session. And then we have a VA funded mobility manager, a GS-12 mobility manager from Oklahoma coming to talk as well. So if you're interested in sort of hearing about, I think it might be a good session. I'll put this in the chat.
Thank you.
Sure. All right.
There it is. Thank you. And we're going to keep that down because I know we've had several people ask about the presentations and slides. We'll put together all of the comments and the notes as well as the slides for everyone who had registered, and send it out so that we could induce other people to participate and join and hear. We want to, I'm a big fan of hearing the story of others. I always learn through my own mistakes. Sometimes it's nicer to learn from other people's trials and tribulations and how they got to the roadmap of success. So then you don't have to trip over things yourself. And so those are great. That's a great resource for us. We appreciate it.
Yeah, please feel free to share my slides, and you're welcome to share them in PDF, PowerPoint, so people can copy and paste easier. I'm fine with that.
Okay. Thank you. Thank you.
Okay, we are done with that presentation about 30 minutes early. So I am going to check here. Just give me a moment to see if the next presenter is ready. I know that she was coming from another presentation. So that is why we had to switch.
You guys were so nice. I assumed you guys would have a lot of questions.
I thought there'd be a lot of questions too, which is why you had more time. So I guess everyone's shy.
I think we're digesting too, right? It's
I was worried about being long-winded and going over. I would have thrown more slides in there.
It's okay.
Yeah.
Give me just a few seconds and I will contact her, see if she's logged in here.
No problem. No problem at all. Thanks, Anjali.
Will any of you guys be at CTAA next week?
No one from CUTR that I know of will be there. But I know we want to get into the rhythm of that. It's so hard, right? With CTAA, we have a conference at the beginning of June for us, so it becomes really, really a busy time for us to find ourselves out of the office a lot.
I think, Martin, while I'm contacting Kelly to see if she may be able to log in a little bit earlier, did you want to kind of recap the day or review and see if there's any other questions?
Yeah, that's a great idea. Let me pull up. I mean, I guess, I think one of the things that I know the first two sessions after yours, session 2 and 3, where we were talking about the partnerships and creating a mobility management network. Are there any thoughts or insights from the participants, not the participants, the attendees, I guess, right, that want to revisit those topics? Because I do feel like, I know when we were preparing for this, Jonathan was hearing from people, there are more folks that are looking towards mobility management and finding opportunities for like, well, help me understand what I should be doing. And I really think that that was a sign to us that this would be, a fruitful endeavor. And let me see if I could, there I am. I just thought it would be illustrative of kind of an opportunity for us to recognize how those connections are important within District 1, and how we can leverage each of your experiences within the district as you're working through ways to leverage mobility management strategies. I thought that was the most resonant one that I know popped up. Anyone else? Folks, Anjali's kind of prompting us with a question. Other types of partners that you're looking to connect with that you may not have already, and some way that you wish you could connect with them that you're not making the connection. The VA is one that I know when you brought it up, we noticed there's a couple of large VA facilities in Tampa Bay, and that's always a difficult travel for folks to make their way all the way over here when you're in the District 1 arena.
Martin, could I say something on that point based on some experience in New Hampshire?
Yeah, definitely, Steve.
One of the things that I found is important is do not assume that people understand things. So you've just heard from Danielle and all the CCAM work. You may think to yourself, well, HUD must know that this is an effort and will reach out, and anybody that works within HUD down at the state level just knows what's happening. We found they don't. So when in my presentation I talked about don't going empty-handed, and that was to the legislature. When you're trying to make connections, we definitely found do not assume that they understand. Be prepared to talk about the upstream federal side of things, how funding priorities are changing, and that this is under that thing is they need to know that themselves. And that has opened the door for people to listen a little more closely to what we have to say and offer.
Thank you for that. And actually, what I love about the mobility management model is that it's customer centered, right? And when we talk about the customers, whether you're with the VA or with whatever the pool of partners that you're looking to connect with, when you start with the customer's needs at heart, I think it really creates a connection of saying, oh yeah, we really do care about this, and let's see how we can figure this out. I mean, I've noticed I've had family members living in senior facilities that were like they're not full. They weren't full. They were able to live independently, but they didn't have the ability to drive. And coordinating their trips to Target and to Walmart, and they'd have Target Day, and I just thought, wow, what a great way of coordinating. It was across the street from the senior center, so folks would come across from the senior center, hop in. Tuesdays is Target Day. They'd be able to go through their shopping, every other week, whatever it was. I forget the timing now, but I thought, what a meaningful experience for the customers. They were thrilled, and finding ways to support that kind of activity, I think is so resonant with, I think, the kind of work that we're doing here. And that's what makes mobility management. I just get hung up on the customer-centered perspective, because I just feel like when you start there, you end up in the right place. If you think about their needs, and then, sometimes I think we were talking about vicarious storytelling. I think it was the people from Kansas, were saying, when we make sure we share those stories in our discussion, because data and a story is compelling, right? And then you throw in the opportunity for funding support, then it gets people their eyes open up even more.
It's that personal touch. I know I often open up these workshops by asking people, show of hands, how many of you got into this work because you love performance measures, you love creating logic models, you love, whatever. And of course, everybody laughs. But it's a reminder that the majority of us, I know there are some folks that just love to drive buses. I know a few of them, but I think the majority of us really came at this work because we have an innate desire to try to help folks where they're at. And that's why mobility management is just perfect. You start with them in the center. So
yeah, it dovetails. And I know we do. See Anjali wanting to ask you.
Yes, that's not what he was presenting here. That's for another one we're doing, but if he could share, that'd be great, because I think that would be helpful.
Sure. So in New Hampshire, we have what I call the state version of CCAM. We have a state coordinating council, and then we have regional coordination councils. And I know many of you here have adopted similar systems. So for us, our state council does very much try to follow the CCAM makeup. So we have brought our state agencies through that. Now, I will say that DHHS is sort of the biggest player. We have so much transportation funding and need. So they're a high level representative. We have Department of Education there. We have our state Department of Veteran and Community Affairs participates, and we're constantly trying to bring in others. Then, as a result of our mobility management network, because we were funded with that CDC COVID disparity grant that I mentioned earlier, we use that as a leverage to connect our transit folks to healthcare. So we have our regions partnering with their regional healthcare network. We have folks like myself working at a higher level with different foundations who are managing aspects for the healthcare industry that they're convening to address topics, seeing barriers, planning a session for our upcoming conference where we have two of our big foundations in the New England region. Potentially, we will have Wendy Heaps from Federal CDC, who's been a fantastic partner, and I know is a big help to Danielle and CCAM with bringing health and social determinants of health together. So we're seeing that expand, but virtually across the board, now that people are hearing about us and seeing that we have something to offer, and by the way, that we can do some of the work that people can't add to their plates, there is much more interest. So the partnerships are expanding almost daily. So that's kind of a topical overview. I could probably start thinking. I mean, we have our regional planning commissions are involved. DOT is involved at every level, which is fantastic. We have municipalities who aren't usually directly at the table, but they're providing matching funds for these services throughout the state. So they're critically important. We're talking with the legislature about perhaps forming a public and community transportation group that would band together and advocate more strongly for these needs. So all of this is a catalyst that I have to say has been driven by the concept of CCAM and the development of our mobility management network.
Thank
Hey,
you.
Steve, Jonathan here from CUTR. Question: How long did it take you to coordinate this? It sounds like, and I don't mean that cynically, but it takes time, and we've talked to a number of our agencies in the district, and it's clear that many are beginning the coordination that really, I think, gets you to these networks and working. But just curious how long that took, and because it seems like it's running quite well now.
It is. So it's a good question. And I have a presentation that I do where I sort of talk about the recipes, the recipe for collaboration or doing what we did in New Hampshire. So it started first, the concept of a mobility managers and mobility management had been highlighted in some previous studies that go back. I think the latest one was, or the previous one had been 2016. It just sort of scratched the surface. So as we started looking how to be more effective, a couple of things happened. The first was that DOT positioned itself to be incredibly supportive, somewhat skeptical. DOTs don't tend to be as process oriented as folks like myself. So, but they were willing. So they set the tone. Then we had some resources. Our first batch of resources were some flexed funding that we convinced the state by virtue of the public repeatedly asking for. That provided us with seed money. And as you know, money gets people to the table. Then the CDC grant upped the ante. And suddenly, not only did we cover the full-time salaries for mobility managers, but we had some discretionary project funding for mobility management projects, which is a lot different than the specific 5310 funding, for example, where you have to spend it on certain populations in a certain way. Those things were all carrots that brought them to the table. But before we could take advantage of a dime, we spent about 2.5 years of planning, because first we had to plan how we were going to use that flexed amount of dollars, just generally speaking. And when we said we want to carve out some for a mobility management network, then we had to go. The second thing that I think another thing that I think is critical is I do think that you have to have some people that are visionary and instigators like myself, because I was able to make this my focus, because I was not trying to run rides and run another organization. It's not that people can't do that. In fact, I relied on those partners, but I had more time because that was my job. So I was able to put a lot into that. I could research, I could talk, I could convene folks, we could come to consensus, and I would update the plan, and then I would move it forward. So I do think you need DOT, need to have some funding to support this, and then you instigators who are willing to lift a little more. Now, at the point we're in, and we're about midstream in our implementation, I'm learning, as expected, that there are some challenging areas. So I will not lie. We can't let up. We are still working through issues. We are still trying to make sure that we aren't creating bigger silos after we just tried to rip those silos down so we could work better together. So it does require vigilance. It does mean sometimes there are confrontational conversations that have to occur. I think the best thing is if everybody keeps their eye on the ball, which is the customer is at the center of this. We are doing these things and having these hard discussions because we want to improve this. So that's a very slide. How did we get here?
No, but I appreciate it, Steve. It outlines how it's not just something you turn the page tomorrow and it takes some time and some coordination and some strategies and to get it right. So
Yes.
thank you.
Thank you, Steve.
You're welcome.
Can I
Kelly
ask
is-
a question?
Oh, go ahead.
Steve, how involved is the Administration for Children and Families, like your Head Start type partner at the state level for you guys?
Head Start, not enough. In general, Department of Education, we're actively engaged in conversations by saying, there is so much there that we need to come together on. I mean, just school transportation is one issue, but to your point, there's more specialized needs like Head Start. We're trying. Our DHHS, which is all encompassing, they have pieces of this as well. And we have pretty solid. So our representative is appointed by the commissioner. And so that creates a direct conduit. So we have a member who is actually the Bureau of Employment Services and things like TANF, and they've got their eyes on all of this. Need to get kids to Head Start. Families need to have some level of transportation to function. People that are coming off of support and TANF need to have options. So Gene is able to bring these issues up the chain of command in a very appropriate way, and he's been a huge asset. We need more Genes across the different agencies so that we can actually go after those, because we are taking a nod from, again, CCAM, where you're looking at the expanded needs of food insecurity, housing, you name it. We're trying to take that and use it and say, look, federal level is expressing this as a priority. We need to look at this and then use that to bring people to the table.
I just wanted to give you a heads up that ACF is putting together with National Head Start Association and Civic Mapping Initiative. In October, they're launching the Head Start Transit Map. In October is Head Start Awareness Month. That's why it's rolling out. And when they mapped all of the public transit with the 1,700 Head Start locations, they found that only 40% were in proximity of 5 miles to a transit stop. And then they looked state by state, and they're doing a working paper. So we met earlier this week to get a heads up on all that's coming. And so I think there can be a huge push to try and, so I was just curious.
That's really exciting. It's, I know, speaking to all of you out there in the field, I understand when you hear like an FTA, a DOT, or someone like me come in and say, you should do this and this. I realize how exhausting it can be. And one more thing feels like the straw that would break the camel's back. But remember the strategic value of some of these things. Wouldn't it be better to position yourself so that you are ready to move into the flow of the funding streams or the initiatives that are coming out there, the resources that are being put out online? So I love finding these opportunities. It does not mean that we go for everyone or have the capacity, but we do find them as leverage points. So thank you, Danielle.
Sharing this stuff ahead of, but I just wanted to let you know it was coming and sort of.
Find the pump. Actually, on that line, Danielle, Judy Shanley had sent me about a week or so ago, and I haven't been able to follow up on it, but she was talking about, I believe it's a NOFO, but they're talking about having mobility management embedded within the Department of Education. I saw that and I leapt out of my chair because I was like, wait, we're trying to bring them in. Is this an opportunity to seat someone there, incorporate them into our emerging network, and what might that do? So then I had to come back to earth and deal with the rest of that week. But that's another opportunity that if you know anything more about it, I'd love to hear it. But it's a great way to bring in another state agency.
I would love that. Department of Education, Erin McHugh is our CCAM point of contact. She's lovely. But she's not in the same office I imagine this is out of, but I would love to learn more and help and coordinate with that. That'd be great.
Yes, great.
Unfortunately, most school buses are funded locally, which means they're not federally funded. So the coordination opportunity is kind of minimal when we talk about federal fund braiding. And so when we looked into that, it's not as, we got our hopes up. I
agree. And I think that's why we've, to the limited extent we've sort of had this conversation, because some of our providers also do bus service as part of their operations, and they're usually banging their head. We've had directors that are out in the field driving because of the driver shortage, and they're about afraid at this point. But this is an area where I think, okay, we might not have as nice a fund braiding opportunity, but we do talk about how the services come together and provide a sort of a solid net of mobility options for all ages. Because, mobility, 5310 fund, of course, older adults, but mobility management is about mobility for all. We care whether the kids are getting to after school programs just as much as we care whether older adults are getting to social activities. And
I think the key is the incidental use and ability to charge anything from free to the fully allocated cost for those trips. So basically a charter service funding arrangement with one of those CCAM agencies that have an exception to the charter rule. No need to register. You automatically can have that relationship. So I think that's the key for any kid after school program, low income kid with a disability, getting them to and from, and then charging for that service. So there's a lot of opportunity that this new guidance, we're really trying to clarify, you can do this. It's allowable, and really highlighting that. And I think the next step, we're about to update the Charter Rural Appendix A. That's going to be huge because CDC, the high obesity program, goes to land grant universities. And our charter rule says universities are not qualified human service organizations, but the CDC programs aren't on Appendix A right now. So there's some confusion out there that this update will really clarify.
Well, that's good to hear, because it's things like that folks that maybe not inclined to complicate their world will just point to as a default and say, oh no, it's a charter, or oh no, it says this. And what we're finding is you all are responding and trying to make that easier, but we're also finding that sometimes there's been a very interesting interpretation. So I love this guide's coming, and that issue alone, I really do think could be a game changer for a lot of people in different regions.
Oh, I see the food access. Love that you guys are touching on that.
Yeah, I just thought I'd put in there, in my last life working at a transit agency, we had a phone call with the state extension service folks that were heavily involved with food pantries in a county. And they were amazed how many of the food pantries that they helped place or fund weren't on transit routes. And in a case of a county that had fixed route transit. And they were surprised because they could actually affect, in some cases, where maybe more temporary food pantries were located. And we were arguing, especially for the fare-free transit systems, if you try to put these food pantries on a fixed route or in a zone where there's other type of service, this is maybe one of the easiest ways to coordinate. So many of you out there could probably take a look at the food pantries in your service areas now and find out who's organizing those, for example. And when new ones pop up or temporary ones pop up, maybe these agencies will remember you in your transit system and your service, and maybe locate it where they can actually ride your existing service just to get to something as important as food access. So in this case, the state extension service, I recommended to them that they have a layer in their GIS system for statewide food pantries of the local transit systems, fixed routes, and any other on-demand or paratransit type of service that could be there, that all the decision making, maybe in the food section, the extension, make sure you check that transit layer. You'd never know when you're making some decisions. So I'm just throwing that out there as an example of a group of folks that didn't really know about us in transit, and that might be low-hanging fruit in your community, especially ones with fixed routes. I think this gets a little harder with rural areas, but just a little tip there I thought I'd throw in the box.
Hey, Jonathan, that was great. In fact, you were timely. I had to step away for a little bit ago because I was having a meeting about updating our GTFS flex feeds. And I definitely wrote down add food pantries to that so that we could get that overlay. I think that's something, because in New Hampshire, we are looking at this. There is some collaboration already happening, particularly with Meals on Wheels. Some of that is braided funding. Of course, the pandemic, as we know, we had to get creative real fast. So we have had examples of some of our different programs, including our volunteer driver programs, where they helped with food delivery. And, you know, this takes me back to what Angelique touched on briefly earlier on, was the work group she's convened, which I am a member of, that is looking at successful examples. I love the idea of seeing what another area did and transplanting that. Certainly you make it unique for your needs, but why reinvent the wheel? So I think the research that Anjali's work group is going to do is going to highlight a lot of these different initiatives, and they may help to give you ideas about what you can do locally here in Florida to make those connections. Another piece in New Hampshire is, as I mentioned, we're trying to make deeper connections with the healthcare side. Well, in that exploration, I began talking with peer groups who are responsible for community benefit dollars from the hospitals. And food insecurity is at the top of their lists statewide at this point. And I'm sure that's the case in most other states right now. And so when you hear that they're looking to spend their required community benefit dollars on food insecurity, and you have a mobility solution to pair with that, that's good timing. So that's something we're also trying to capitalize on.
Appreciate it, Steve. And another quick food tip is the heavy truck or the forklifts. Think about who you might be able to partner to help if you are helping with food pantries, or maybe you can't do this yourself exactly as a transit agency, but we are hearing that a lot. You know, this is great, but we just can't move these pallets of foods. And so is there another part of your county government or a partner you can find, a rental truck agency? There's all sorts of partnerships. When we say coordination, it may not be grading, it may not be instant cash match for your grants. It may just be partnerships with that bank or that rental agency that might be able to help solve that problem in the whole wheelhouse. And so just keep that in mind. That's some of the things you can think about in the next round when we come around with technical assistance, those types of partnerships. So just a few thoughts on food access.
Thanks, Jonathan.
Okay, thank you.
Two things.
Okay.
I don't want to. If Lisa is here, I'm ready to. Not.
I apologize. I did not see
delays.
Kelly on here. I don't know if the time zones got her mixed up. I'm not sure. We'll give her maybe 10 more minutes, and then we may have to move on or kind of see what we can do.
Okay.
Go ahead.
Well, then I could at least add this comment that Heidi commented that when you're coordinating with food pantries, make sure you know about the policy related to bags. How many bags a rider can have is important, and that's a really good point. The other thing, Steve, in my other life, I'm a little bit of a GIS, GTFS geek and nerd, and you mentioned the GTFS Flex, and I have been daydreaming about finding opportunities for setting up GTFS Flex. And, you know, whether it's Open Trip Planner or whatever the mechanism is to make it work. How effective, how has that been working in your experience I guess maybe I'll say GTFS Flex is an attempt to make public paratransit on demand, not on demand, but paratransit type service to be similar to what you could do with Google Transit. So if you're open up Google Maps, and you could say, I want to go from point A to point B, I want to use the bus. That's GTFS. So that's the General Transit Fleet Specification. That's why that works. So this is me saying it to others. I know you know this, Steve, but then the GTFS Flex is kind of expanding it to say it's not just fixed route. There's a way that it could work perhaps with these paratransit services, which would be really interesting. So I'm just curious about your relationship with that and how that is working in areas that you're familiar with.
Yeah, well, the discussion I was just having was we are trying to secure funding through our CDC grant project for the Mobility Management Network. So in my statewide contract, my deliverables, I've grouped a bunch of it to enhance communication. So this is where we're doing a brand new statewide website. Somebody mentioned Vermont's Go website, which is fantastic. We're modeling similarly to that. We'll have a database. We're incorporating Agile Mile as a visual that will be embedded on the site so folks can use that. But as we know, we're only as strong as our GTFS feeds getting this data. So we are using this project as a catalyst to get all of our regional planning commissions and DOT on board. We are trying to specifically fund Trillium. Trillium is responsible in part for writing the book on the flex feeds at the higher levels of federal government and things. So they are a huge resource. They're professional, so it's costs, but we're trying to bring them on board for a modest contract to guide us through the process, because what we want to do is get people to understand why investing in our feeds and keeping them up to date are going to bring tons of benefits across the board, and why we need to continue to fund support of that. But beyond that, we're also trying to teach our own people how to maintain. So in other words, we don't want to waste this money and not have learned anything. So we're positioning, we have qualified folks who could handle the programming of the feeds, the coding of it, in our regional planning commissions, as well as the Department of Planning within DOT in New Hampshire. So it's kind of nice. I've umbrellaed it under all things website and enhanced communication for our purposes of funding it, but it's having this effect. And I'm not even the one that has to be out there selling it, because I have one of the executive directors of our planning commissions is working his colleagues about why we have to get behind this. The time is now. Here are the benefits. So to be continued in our story.
That's good to know. That's good to know. Sorry, I was muted. I didn't want you to hear me typing, because I was like typing down notes. It's been a while since I've played with the Flex. I'm only vaguely familiar with it and how it operates. I'm much better with the fixed route GTFS files set. Thank you for that.
I've told everybody, don't look to me to code anything or to do any of that. It's not gonna work.
Yeah. That's kind of a little bit of I know how to use the data. I know how to import it and use it in different software settings, which are really useful.
Great.
So Anjali, our session 7, right, is going to be focusing on travel training, and Kelly,
Yes.
like you said, maybe just off, right, by accident.
Yeah, maybe she's off by accident. I'm hoping nothing happened. I sent reminders 5 days ahead, 3 days ahead. I heard from yesterday. I didn't hear, but I heard from the day before yesterday. And then I sent reminders to everybody this morning, as Steve, Danielle, everyone knew, just reminder again, that the time zone. So I'm not sure what exactly happened.
Well, we'll hope for the best. We know sometimes the world turns upside down.
Yes.
And in in the virtual world, we don't know what happens, but sometimes in the real world, we're like, oh, it's a fender bender, a traffic accident, the road's closed, and I'm not making it there. Yeah.
Yes.
So let's hope it's nothing serious. And I know by 2:30 we want to try to touch down on the closing remarks. But are there other things that we could think about with the travel training? I guess maybe we can make sure we send the slides. Go ahead,
Yes,
sorry.
we do have the slides for the travel training. We can touch on the topic still. We just like to bring other people in regarding the travel training. I am interested, which is a question that she was going to ask, is who exactly is doing travel training and the type of programs that they are currently doing. Excuse me. And so if you would mind dropping that in the chat for me, that would be helpful.
Yeah.
I do want to, oh, did you have something else to say, Mark?
No.
Okay. I do want to say just a couple of things about travel training, and I can, just a second here. Oh, what do you know? She's here. But something about the code about something registering. Just a second. Maybe it's something with her Zoom.
If she tried calling in for her voice,
Okay.
then that one click didn't work for me. I had to manually type in the code, if that makes
Okay,
sense.
let me tell her. Technology, that must have been the problem.
Yes.
She's like, I can't get in.
So I put that question in the chat already.
Okay, I was gonna say, Kelly, usually she's right there on time, so.
Life happens. Things happen. We know that. I'm always prepared for the possibility of that one day happening where like,
Oh,
oh,
there she
nothing.
is.
disappeared.
Okay, can you hear us, Kelly? There she is, okay. Is your audio working?
It is now. It
There
wasn't.
you go.
It is. Yep,
All
it is
right.
working now.
You
Yeah.
almost scared me. I'm like, oh my gosh, Kelly's always on. Okay,
Yeah,
go ahead and
I
share your
heard you
screen.
guys when I first came in. So you're ready for me now, right?
Yes, go right ahead.
Okay, great. Do you want me to share screen and run through the slides?
Go right ahead and share your
Anjali?
screen.
You want me to do that? Okay,
Yeah.
got it. Give me just a second.
Is it letting you share?
I know I just had to make sure I got the right slide pulled up. And we should be good now. Okay, hopefully you guys can see that. It looks like I can on my end. Hi, I'm Kelly. Nice to see you all. Thanks for having me. I am the Johnson County Mobility Coordinator. So I am in Johnson County, Iowa, and I plan to talk about travel training today. Okay, to get started, I just wanted to give a shout out for where Iowa is here in the United States. So you can see we are right in the what I consider the heart of the Midwest there, very landlocked. The county that I focus in is Johnson County. We are on the eastern portion of the state where you can see the yellow little square there. I think Iowa is unique because we have 99 counties in our one little state. So our counties aren't very big. Here is a zoomed in version of our county. We have 4 public transit systems here. And I'll go through those here in just a little bit and talk about how I interact with those. But we do have a very blended county in that we have the urban center where you can see the yellow, blue, and red colors. And then on the outer parts of the county, we have our more rural communities. Smack dab kind of in the middle there is the University of Iowa, which is a very popular destination for education, of course, but it is also Iowa's largest teaching hospital. And we have people from all over the state and even other states travel to our community for healthcare access. Our official population is just under 160,000 there. If you were looking at square miles, we are 623. So let's talk about the 4 public transit systems that we have here. So back when the public transit funding first became available, we had 4 different agencies established. So those are separated by fixed routes, and then we also have our demand response service. So for fixed routes, and the yellow area that you see covering is the University of Iowa CAN bus. So that is student operated service for university students, but it also serves the healthcare destination. So anybody can ride that. It is a free service. There's no fare. We also have Coralville Transit, so that's reaching up into the city of North Liberty, and it does connect down into Iowa City. So that's represented in the blue shade. And then we have Iowa City Transit, which is probably the largest system here, and also the largest urban county. So there's a lot of overlap. So a lot of my work as the mobility manager and travel training expert is to teach people how these systems interact and how you can travel from one city to another, because what we've learned is people do not always live, work, sleep, recreate in the same city. And I think, as I just said in the beginning, they are separate transit agencies, but they've come a long way in how they can offer, how they work together to make it a seamless travel. So providing demand response and paratransit service for that is our county provider, which is a department here within the county that I work at. And that is called Johnson County Seats. So they operate the paratransit contracts for Coralville and Iowa City. And then they also cover the green area here of the county. So anybody living in these urbanized areas can use their door-to-door demand response service. And I should have said, it doesn't look like there's a whole lot in attendance, so we can definitely pop in and ask questions. And Anjali, if you want to help me monitor the chat, that's great. So a little bit about me. So I actually, oh, go ahead. Okay, so a little bit about me. I am the first person that started this role. There was back in the past some JARC funding, so Job Access Reverse Commute, and that helped the county, Johnson County, jumpstart the position. And when they were first designing that, they were going to have me out with Johnson County Seats, which is our transportation department, but they decided I would have more access to new clients if I was in the county social services department. So I am I have a social work background. I'm under the social services director, and I am on the second floor of this building that you see here, which is where people from our community come to apply for Medicaid, for food assistance. We also have a general assistance program, which is like rental assistance. Excuse me. There is public health in this building. There's a lot of different ways for me to connect with riders. And it's worked out really well working in this, working in the field and being related to social services. I think it helps connect me with my ridership better. So I do prioritize my time for low-income individuals, seniors, people with disabilities, veterans, immigrants and refugees, and youth. And as we get further into some of the travel training practices that I've done, you'll see that I really just work with a lot of different people. It's very rarely that somebody contacts me or shows up to our building that I can't provide help to. So I make my services very accessible that way. For funding my position, there is a cost share. So the County of Johnson, who is my ultimate employer, provides 50% of my position, and then 35% is covered by the city of Iowa City, with 15% from the city of Coralville. And I think that the JARC funding ran out the first year or two that I got started, and that was in 2017. So it's kind of an interesting position being the first one doing this, because then you get to pave the way, but there's also not a lot of expectations or people you can go to for help. So I really enjoy what I do, and will hopefully get to display that through the picture. So let's get into travel training. So when I first got started and had these conversations with the 4 public transit systems here, travel training was their most interested effort that they wanted to offer their ridership. So I started developing a travel training program. I actually got to travel and participate in the Easter Seals travel training certification. And I believe I traveled to Kalamazoo, Michigan, and they also have a really wonderful travel training program. So I got to learn a lot that way, and then bring that back into my hometown here. So for travel training, it works a lot. I really make my services flexible. I think even as transit, we've learned that, hey, let's make our services flexible for the rider instead of expecting the rider to adjust their lifestyle to reflect the bus schedule. So I take that approach and apply that to travel training. So I have a couple photos here. On the left-hand side, you'll see an individual that is just one single individual. He was learning the bus, how to use the bus to get back and forth to work. I also work with groups too. So on the other side of the screen, you can see a group of seniors. Instead of going to work, they were actually going to tour an old schoolhouse. So we made that a very fun outing. So some of the outings end up being more functional and like accessing medical care or the food pantry. And then some of them are fun. I also took another group of seniors out for ice cream and went as far as getting the ice cream shop to donate a free scoop to everybody. So that was a really well-received program. Things did slow down a little bit for me during the pandemic, but I am back with a vengeance. It is been a little nonstop for requests, and that is good because we want people to use our transit systems. So some of the other populations that I've worked with is high school students. So we've got a picture here of the Iowa City Transit bus and a group of high school students riding. So, and I think this is our state law in the state of Iowa. If you are in middle school or high school and you're less than 2 or 3 miles away from the school, you aren't allowed to use any of the school system busing. So that's a pretty long walk, especially in a state that has a winter. So City Transit, Iowa City Transit has a bus route that works very conveniently for the high school students. And this bus is just absolutely packed. And every year at the beginning of the year, I'll get to connect with the student family advocates at the school district. And there's a handful of freshmen or also English language learners that just came to our community for the first time. And I'll get to ride the bus with them to school. Once they get on, they start identifying who their friends are and their peers or classmates, and they feel much more comfortable. But that's a really nice service to be able to offer, especially for somebody that maybe when they were in elementary school, they rode the proper yellow school bus back and forth. But now that they're in high school, that radius of busing has changed, and now they need to ride the city bus. And our city transit does a really wonderful job of reducing the cost of the fare for 18 and under. And then the school district helps buy tickets that make it a really easy access for them too. So then we have on the right-hand side of the screen is a photo from one of my most popular travel training series that I do with English language learners. So we have a community college here in town called Kirkwood, and Kirkwood offers free English language learning classes. So this last session, they had like 180 students signed up to take free English classes. The students are from absolutely all over. We have people coming from Africa, Congo, Sudan. There was a couple from Ukraine. We have, of course, Mexico, Guatemala, Asian countries, just a really big melting pot, and they all sit down together and learn English, and it's a really wonderful experience for them. And it's a free class. So I got to start a partnership with them and kind of collaborate on their unit when they're learning about around town. So one of their units is, to learn about going to the grocery store, and it focuses on the vocabulary with that, or going to the doctor's office and focuses on the vocabulary you might need to learn accessing medical care. So to build upon that unit of education they're learning, we then take a trip by bus to the Iowa City Public Library. So that's what you're seeing here is a group of the ELL learners I travel out to the school, park my car, say hello, pass them all a bus pass, and then we all jump on the, for this class, it's the Iowa City Transit bus. And then we make a quick trip to the downtown. We tour our downtown interchange, which is like the main transfer place. So if you were going to be transferring from one system to another, one bus route to another, it would be done at this open air intersection. And we help them identify signage there, and they have a little scavenger hunt. And then we make our way over to the library. From there, at the library, they get to tour what the library services has to offer. So it's not just books, and every time I go to one of these tours, I learn something new. This last one, I actually learned that our public library has a Cricut machine, and they have the materials and staff to help you learn how to use the Cricut. So if you want to make a t-shirt that's personalized, you can go to our library and do that. You can also check out artwork. They have films and video games and different languages too. So it's really fun to see the students check out the materials and find things that they connect with. In addition to that, some of the students have never been to the library, or have they even ever been to downtown. So there's always a good handful of the students that are like taking pictures and videos or FaceTiming people to show them about their experience. I have been doing this for, I think, 3 years now. And this last session, we were really excited that the City of Iowa City Transit and Coralville Transit donated bus passes. So of course, we got to do some education on the bus. So we teach them about when to pull the cord, where the cord is, how you grab that to make your stop request, and then they get to practice using their fare and putting their bus pass in and out of the fare box. So this year, as I was saying, we were very excited that we got to let the students keep their bus pass. So the bus pass that they were using for this class was a 10 ride. So we used 1 ride downtown, 1 ride back. So they had 8 rides that they could use on their own. Our library, again, is in a very centralized location. So in the summers here, I think starting this week, actually, there's free concerts there. Every Friday night, there's a jungle gym for kids. So there's just all kinds of things that they can learn about and feel welcome and integrated into the community. I'm going to take a quick pause to see if there's any questions, and then I'll keep going. Oh, just a few numbers. I think that we had 83 students go on the bus. And if any of you are from an area where there's a fixed route, if you can imagine 83 people boarding at one time, that's just not going to work. So, but I, as a mobility coordinator, was out on the bus. I think we had 6 different outings. So Iowa City Transit would prefer a group size of 15 at a time. So there was lots of back and forth on the bus there. Okay. Another type of travel training that I offer is what I call trip planning. This is where people want to learn how to ride the bus, but they maybe don't want that level of assistance of me getting on the bus with them. So in that case, I can actually make them a step-by-step trip plan. And so I've got an example of a written format, and then of course a visual format as well. The written format is basically a little bit of a more friendly version of what technology could do. The populations that I work with, I would say 75% of the time have technology access, but there's always a handful of people that don't, or they would just prefer to print a plan and carry it with them as they travel. So I will always make a trip plan for somebody if they need that, and just have that step-by-step instruction for them. I've gone as far as translating this before. We have a company that will do this for us, and they have access to multiple languages. So that's also very helpful as well. So then I've got the picture here. This is it seems like it's not much. It's basically just a Google image there of what you can see circled in the gold. I did add that part there, is where this bus stop is. So this particular person was going to be traveling on the campus of the University of Iowa. So there's a lot of foot traffic, a lot of buses, a lot of cars, students all over the place. So it's kind of hard to figure out where you need to be to board the bus. Especially if you're going to a new place or you just moved to our community. So this is just me going on Google Maps and turning it to Street View so that I can actually find an image of the bus stop that they would be boarding. So that way, if they don't want me to come out in person and train them, I can at least get them pointed in the right direction that way. If somebody meets the demographic requirements, whether they're a veteran, senior, low income, immigrant, refugee, or youth, person with disability, any of those, I will offer them the opportunity to get on the bus together. But like I said, not everybody wants that level of training. Most of the time when I am doing the travel training, the sessions are I would say majority of my sessions are just one time, and the person feels confident and they've eased their anxiety to go out the next time. I will go a second time, but usually not many times after that. Okay. Another level of travel training that I offer is also getting people connected on transit technology. So here in our area, we have the transit app, which I think is a pretty popular one. I'm sure some of you guys know that. We also have kind of a homegrown system, which is called Iowa City Area Transit Service, or ICATS for short. And then we also have our transit information on Google Maps. So every now and then we'll get a group of youngsters, which you see down here. This was actually summer programming for teenagers or preteens. And I got to work with them on learning how to use the transit technology. This is always a really popular one too, because people are excited to learn that they don't have to carry around a paper bus schedule or print a piece of paper. I think I was saying that 75% of my clientele does use technology or has that access. They just need a little bit of coaching on how to get behind the scenes and use that. So a transit app, if any of you guys are familiar with that, it does not, you can't display it on a web browser. So that's only available by smartphone app. So I actually got to work with video production with the city of Iowa City and made a tutorial on how to use that. And it actually uses like bus routes in our area versus just pulling somebody else's content. So that was really helpful to show. And then we get to, I always allow people an opportunity to pull their phone out and practice some things, and I can work one-on-one with people. In addition to that, we talk about the pros and cons of each of those. So in all of our technology instruction, we also review where to find the paper brochures, what the customer service lines are, and just kind of a backup plan in case your battery dies or you don't have service, and just identifying a backup plan there. Okay, I have, I think, just a little bit more, and then we can open it up for questions. So I also, me and my social work background, recognize that not everybody can make their way to my office and ask me questions. So I do a rotation of several on-site outreach efforts where I go to the organization and set up somehow. Sometimes it's in the lobby, sometimes there's like a proper office. Sometimes I'm just sitting next to somebody at a dinner table or lunch table rather. And I usually bring this sign with me, which says, this is going to be backwards, but you can see it up there. Ask me about transportation. So that is enough to pique people's interest. If I have this sign with me, people will stop by and be like, what do you mean about transportation? And I say, oh, well, if you've ever had questions about getting around in our community, I can help you get connected with those resources. So some of the popular places that I do that here in our area is Shelter House. So that's our one and only homeless shelter. Then we have several food pantries. Those are really popular too. We also have a really nice senior center, veterans center, and then as I mentioned, some of those free meal locations are also a really great place to talk about. And I don't just always talk about public transit. We have a couple of like senior volunteer programs here that are operated by nonprofits. This is a great way to share resources with people and connect with people that may not have thought about public transit before. We also have free transportation for seniors and people with disabilities. So I get to talk about those opportunities and how people can save money using our buses. But it's a really great way to connect with people. Oh, okay. This is going to be our last slide. So I think as most areas I'm hoping you all had a chance or knew of somebody that had a chance to access the American Rescue Act plan funds. So our county was received some funds from the COVID relief there, and we actually used some of the funding to start a same-day on-demand service. So this is operated by our Johnson County Seats provider. So they're our demand response provider. And what we designed this service to be was to fulfill the gaps of people that weren't having their needs met by either public transit or senior volunteer programs or things like that. So I am on the referral team and can help people get access to this service. So some of the referrals that we're seeing are people, there always seems to be seniors that have had a sudden or maybe more gradual change to their health, whether that be vision or they had a fall and they've had an injury, things like that, and all of a sudden they can't drive anymore. Likely would be eligible for paratransit service. So as you are probably familiar, door-to-door service for people with disabilities. With the Americans with Disabilities Act law, transit agencies are allowed to take 21 days to review those applications. So not only does it take the 21 days to review the application, our applications are very long. We have some room for improvement there. They, I think it's a dozen pages long. So half of it is from the perspective of the applicant, and then the other half has to be filled out by a medical provider. So it takes a lot of time before you're actually granted access to paratransit. And in most of these situations, the fixed route isn't going to be something that they can do. So we can grant them access to, yep, okay, sorry, I got distracted by that question there. But so in the meantime, we can provide what I call gap service to individuals that are pursuing that paratransit certification. And the question in the chat was, what approach will you take to fund the seats service once the ARPA funds expire? So the ARPA funds that we reserved for this particular project is going to last until, I believe, mid-2025. So we have just a small amount of time. I think that we started about it was August. So we're coming up on a year. And we have a year's worth of data to look at. I personally think it's going amazing. It is just one driver and one vehicle at this time. So that one driver and one vehicle can only do so much, and they do their best to coordinate and make sure everybody gets a ride, but there are definitely some denials that happen. But I think that we have a little bit of time to make the decision on how we would extend this service, but the ridership is there. So it's been a very popular service. We also extend this service for people that there's a few areas of town that just like the bus route is on the other side of the railroad tracks and then a freeway with no sidewalk. So in those cases where it's unsafe or the distance is very far for somebody to get to the nearest bus route, we will also grant them access to this program. So definitely got my hands into that, and it's been very nice to provide a solution to folks when they find themselves in a transportation pickle. That is all I had. I do have my contact information up here, so if you ever want to talk about swap stories on practices, I would love to engage with you.
Thank you, Kelly.
Thanks.
I'm sure you'll have plenty of questions sent your way. I'll turn it over to Martin to wrap up then.
Okay. I'm going to take this off, but if you want to send it, you're welcome to do that.
Thank you very much, Anjali. Appreciate it. I'm assuming everyone can see my screen okay?
Yes.
See some thumbs up. That's great. Thank you. Thank you, Kelly. We appreciate your insights and expertise and experience. You know, as we wrap up, I know I want to be respectful of everyone's time, but as we kind of wrap up, we want to review a little bit what we've seen, you know, our intention of what we wanted to achieve today. You know, we had some really great speakers sharing their stories. I always like to call it sharing of stories, because I think that's what really resonates with us when we're looking for motivation, inspiration, direction, and insight. You know, those are the stories that really connect for us. So those were really great, and I really appreciate everyone's input on that. And you know, when I think about what we saw today, there were a couple of common threads that kind of kept popping out to me that I thought was actually resonant, I guess, and spoke to me as this is a common thread that I think we're all already looking towards, which is partnerships and coordination. I don't think there's anyone who's spoken today that hadn't emphasized the importance of those partnerships and the coordination and the effort it takes to curate those relationships, build them, make them working relationships. Those are really important, I think, messages for us to kind of gain from today's experience. And one of the things that I want to just say again is thank you to everyone. This is kind of a, I guess I could snap my fingers, right? That it will be something that we really appreciate your input and your time. We all know how much time is of the essence and difficult for all of us. And spending the time with you this afternoon is something that I feel like is really something that emphasizes how important this is. I also want to say thank you to Anjali for helping curate today's sessions, working with us, working with our District 1 partners, and working through the topics that we thought were relevant to the District 1 environment, right? It's a very large area, and it has a mixture of rural and urban areas, so that was really great for us to do that. Now, what we want to do is, I want to forward, Anjali will forward a survey. Everyone who's registered and attendant today will get a follow-up survey, and we'll disseminate the information about the slides that were asked about and facilitate the technical assistance support. Go ahead, Anjali.
Hey, March, I just want to tell you, it will come from, if you see a weird email, it's Sogalytics. We no longer use SurveyMonkey, so you might look for it. It should come out immediately, and look in your junk mail. If not, I will go ahead and manually send it out again anyway, just in case something weird happens, or maybe there's like a blocker. So.
Okay, perfect. Thank you for that note, because those things sometimes are like, I don't recognize this. So that's perfect. And again, some of the key, for me, some of the key takeaways, here we go. I wasn't clicking forward, is that idea that partnerships and service coordination, and I think all of us are here are looking at program improvements. And I think there's a real demand for a mobility management network. We're already getting some, communication and connection, and we certainly want to facilitate that. And I know the importance of being able to evaluate and demonstrate the value that you have with performance measurements are still going to be kind of a key important element. And I guess that last bullet, that technical assistance, the email that you'll get from Anjali will include a request for technical assistance, because we want to make sure that we follow up, because this program, what we've been doing, is really the second phase in something we've been coordinating with the National Center as well as with District 1. We're in phase 2, looking at the mobility, the summit as we characterize it, looking at ideas, partnerships, and showing off, really, right? We're telling good stories about what people are doing around the country, which we thought was important. And this next phase, we want to capture some of the summit takeaways, work towards solutions and technical assistance, and finding ways that we at CUTR and with District 1 and National Center folks to provide some really targeted technical assistance to assess where you're at, figure out ways how you can move forward with some of these new approaches and some of these familiar approaches, right? Some of these you've heard of before, but it's challenging to move forward. Sometimes for whatever good or bad reason, there are little barriers between that. So again, we'll get a final note out to you via email. You'll be hearing from us as we kind of move towards the phase 3 process, and really trying to take these ideas into actions and to plans, right? Because as we've seen today, a lot of these things, I appreciated the perspective from New Hampshire. Like, you have to have the long view of this about how you curate and grow these programs and make them really effective and sustainable. I loved the illustration about sustainability. So Anjali, I want to give you an opportunity to say some final words, and Michelle Peranto, if there's something else you wanted to add as the final words, and then sign off. Let you all get back to your day job, so to speak.
Thanks, Martin. I just wanted to really give a great big thank you to Anjali. This was, I felt like it was a great day. It was time well spent. I've learned so much about mobility management, and I'm excited for our partners in our district to be able to utilize this information and really put it to good use, right? We could not have done this without CUTR creating this relationship with Anjali and all of her contacts that she has. So we look forward to the next one, Anjali.
Thanks, Michelle. Well, I appreciate we have a Q&A. Quickly check. Oh, just thank you, Marcia. Roberson, no relationship to Jonathan Roberson on the CUTR team, at least not within two or three family generations that we know of. But thank you, Marcia. Well, with that, I want to be able to sign off, give you all, an appreciation of your time and interest. And again, if you don't hear from the folks in the, if you don't get your survey information, we will just reach out to myself or Jonathan. And again, we'll be sending another email out as well that will maybe not be blocked by any spam if that's possible. But we want to stay in contact and keep the momentum going. So with that, thank you very much. I appreciate everyone's time, and I hope everyone has a great rest of your afternoon. Thank you.
Have a great weekend, everyone.
Thanks, everybody.
Thank you, everybody.
Bye-bye.
Much appreciated.